If everybody could take their seat and we'll get started. Great. Thank you so very much. It's a pleasure to welcome everybody here today for another in a series of our distinguished seminars talks under the theme of public health advocacy that's sponsored by the Center for Public Health Advocacy. And we're particularly pleased today to have a very distinguished speaker with us, Dr. Mark Suzman. And as I was thinking about Mark's remarks today, and the vision for his talk, I was reminded of all the wonderful advocacy efforts of our time, advocacy efforts that have led to really enormous wins for the field of public health and for the public's health. Perhaps one of the earliest advocates, as I think we all are aware, was E.V. McCollum, nicknamed Dr. Vitamin, who wrote regular columns for McCall's magazine to, quote, translate the mysteries of the laboratory into kitchen commonplaces. The fact that this successful advocacy effort showed up in women's magazines rather than in a peer-reviewed journal that we're most familiar with demonstrates that advocacy can be impactful in the unlikeliest of places. Later, our own Al Sommer, previous dean of the School of Public Health, and his team found that vitamin A can significantly reduce preventable blindness in children. The team went on to advocate for the increased use of vitamin A, not only to reduce blindness, but to reduce deadly infections with a significant impact on childhood mortality. And in the 1970s, extensive research in our Center for Injury Research and Policy led to introduction of seatbelt laws and widespread campaigns that literally changed social norms and brought seatbelts in vogue, an effort that helped to significantly reduce car crash fatalities. And the list of advocates can go on and on. We can come up with lots of different examples of what our own faculty have done in the name of advocacy. And as we look to the future challenges facing public health, it's clear that advocacy will continue to be a driving force. And it is pressing that each of us, as public health professionals, continuously and unequivocally communicate and advocate for the value of public health. And that is why, in our strategic plan, we have prioritized advocacy as one of 5 pillars on which our plan is built. Over the next 10 years, we will continue to raise the profile of advocacy as an important approach to improving public health, and we'll be investing more and more into our Center for Public Health Advocacy. Now, we're especially honored today to have with us Dr. Mark Suzman, who himself is a well-known advocate for global health. Mark leads the Bill and Melinda Gates Foundation's efforts to build strategic relationships with governments, private philanthropists, and other key partners to increase awareness, action, and resources devoted to foundation programs in both the U.S. and abroad. Additionally, he oversees the foundation's regional offices and strategic presence in Europe and China, as well as grant portfolios supporting cross-cutting policy research, advocacy, communications, and select country-level delivery efforts. Sounds like a really big job. As Chief Strategy Officer, he also manages foundation-wide learning initiatives and critical strategic trade-offs across all the foundation's work. Mark joined the foundation in 2007 as Director of the Global Development Policy Advocacy and Special Initiatives. And in 2012, he was appointed President of Global Policy Advocacy and Country Programs. And then in 2016, he was appointed with additional responsibilities as the foundation's first Chief Strategy Officer. Prior to joining the foundation in 2007, Mark had multiple positions in the United Nations, including Senior Advisor for Policy and Strategic Communications in the Office of the Secretary General, and Policy Director in the Office of the Administrator of the United Nations Development Program. Prior to that, he was a correspondent for the Financial Times. Mark holds a doctorate in international relations from Oxford University, where he was a Rhodes Scholar. He earned his bachelor's degree, summa cum laude, from a university up north, better known as Harvard University. Mark will first present us with some prepared remarks, and then following his prepared remarks, Oying Ramon was going to ask him the real tough questions, and they're going to have a discussion, and then we'll open it up to questions from the audience. As most of you know in the audience know, Oying is the founding director of the Center for Public Health Advocacy, while concurrently serving as the director of the Bill and Melinda Gates Institute for Population and Reproductive Health. Oying is a senior scientist in the Department of Population, Family, and Reproductive Health. With that, please join me in welcoming Mark Suzman. Mark?
Oops, sorry. Great, thank you. Great, so thank you very much, Dean, for that great introduction. Thank you to all of you for being here. And it's really an enormous pleasure to be able to come and address an audience like this, because the narrative that you just heard from the Dean about how in many ways this school has been a pioneer of how you use advocacy to drive different public health outcomes is something you knew a lot sooner than the Gates Foundation did. And if we look at the journey of what we do as the Gates Foundation, you asked Bill and Melinda when they first set up the foundation as a full foundation in 2000. I'll put aside the Gates Institute here, which was actually largely the brainchild of Bill Gates Sr. At the time he was being asked to do Bill and Melinda's philanthropy for them, because Bill was very much full-time at Microsoft and Melinda was still at home with their youngest children, is they would say, they didn't think about advocacy at all. To the extent they had a vision of building the foundation and starting the foundation early on, it was, we want to build a foundation. We do want it to focus particularly on global health and in the United States in education and domestic education, but we think our added value as a foundation sitting in Seattle on the Northwest, on the Pacific Ocean, is really to create public goods where there have been demonstrable market failures. We want to be able to use our capital. We don't want to be doing things that private sector capital can do. We don't want to be doing things that government's already doing. A lot of that pushes us into the research and development space, into, as you do see big neglected things in areas like rotavirus or a malaria vaccine. We would create great products, and somehow the world, the system, would take care of making sure those products got to those who needed them. So there was no advocacy division in the original Gates Foundation at all. And Bill and Melinda didn't see that as being part of their role. And that changed dramatically over the course of the last now 19 years. And one of the things, just to ground us, and I'll come back to some health-specific initiatives, but is the goal of the Gates Foundation and the mission that Bill and Melinda put, and for those of you who visit us, is carved on our wall outside, is that every person deserves the chance to a healthy and productive life. That's our founding principle. That's the mission. It's deeply felt by our founders. And to do that, you need to have a sense of what we like to call impatient optimism, that progress is possible and can happen and can be driven. And actually, for all the gloom and doom of today's wider political discussions, which we can come back to in the Q&A, the good news is progress is not just possible, but happening. I'll just use this as a poverty rate. This comes from World Bank data. Some of you will be familiar with it, many of you might not be. But if you just track the reduction in the proportion of people living in extreme poverty since 1990 to 2017, and actually at last week's World Bank IMF meetings, they released some updated data, which shows the current number actually gets down to just around 8%. That's an amazing reduction. In fact, that's the greatest improvement for human well-being writ large that's ever happened over any comparable time period in human history. And it shows you that change is not only possible, but happening, and it's mostly happening in developing countries. And the real question is, how do institutions like ours, as a fund, institutions like yours that are interested in these issues, contribute to helping drive that forward? How do we drive that progress forward together? So one of this framework is to think about goal setting. And again, these are the Millennium Development Goals. Again, hopefully several of you are familiar with them. They were launched by the United Nations in September 2000. I was actually part of the team that helped develop them and then launch them in 2000, which was at the time seen as a completely ridiculous pipe dream. Goal number one there, the goal is to eradicate extreme poverty, but it actually came attached with numerical targets. It was to reduce the proportion of people living in poverty by half by 2015. As I've just showed you on that graph, we did way better than that. the world actually reduced poverty by more than half. And what these goals represented was, at their headline, big aspirational goals, and those were goals set by every country in the United Nations, accountability to their own citizens. It's a collective shared set of responsibilities, and it was attached to concrete measurable targets. This is what became a fundamental difference to previous kind of goal settings. Yes, you had the overall aspirational goal, eradicate poverty, but then you had a concrete set of targets. And in health, and the reduced child mortality, that came attached with a very specific target again. Let's reduce child mortality by 2/3 by 2015. Let's reduce maternal mortality in goal 5 by 3/4 by 2015. Now, we didn't meet all of those goals and targets, but what we did see was the most dramatic progress that had ever happened at scale in driving those goals down, and the measurement and that framing was a key contributing factor to it. And you can see the heavy preponderance of health in there. Health in the reduced child mortality goal, the maternal health goal, the combat HIV, TB, malaria, and other diseases. And in each of those, we basically ended up halving. We halved the global burden of deaths by HIV, and there was a big contribution was the Global Fund to fight HIV, TB, and malaria, which I'll come back to. We ended up reducing child mortality by more than half, but many, many countries actually did meet that 2/3 target. So, and those are not just, people tend to think of was progress driven by China and maybe India. Yes, those were big contributing factors because they're so big. But other countries that reduced child mortality by 2/3 include Tanzania, Rwanda, Niger, Senegal. There's a large list of countries where you saw that progress actually happening, and the interventions that happened to drive that forward were the types of interventions that we and others in parts of the room were helping drive forward, like the Gavi Vaccine Alliance, which was founded in 2001, to which we were major contributors to. And by massively expanding the range and the scope of vaccines available to poor kids in poor countries, you help drive the child mortality burden down. And advocacy becomes a key component of that because you're both telling the story, whether it's in the HIV story, in the vaccine story. I'll come back in a little bit of time, and I'm sure Oying will make us talk more about the family planning story and access to family planning. These things become a virtuous circle which help drive each other forward, but you need tools, you need partners, you need coalitions to drive that. And those goals ended in 2015. So what do we have now? What's our framework within which we need to take forward and drive that set of results? And the good news is, we have a new framework, the Sustainable Development Goals. These were built, and it was actually interesting being part of the comparing the growth of the Millennium Development Goals, which no one actually took seriously or knew was really going to exist. So we were able to do it a little bit almost by stealth in the UN by sort of creating these targets. By the time these came around, the secret was out. People understood smart goal setting in development can actually drive results in action. And so massive constituencies wanted to make sure their issues were being represented and their targets and that issue of measurability. So you ended up with this complicated 3-year negotiated process at the UN, which landed in 2015 with these 17 goals, which actually come attached with 167 targets. That's a lot. Now, on one level, that feels like too complex and too big to be, because if you have 167 priorities, how do you have any? On another, it's actually a good reflection of the reality of the range of challenges we have, and it tackles many issues the original MDGs were actually relatively weak at. If you take one of my favorite goals in this, goal 5 on gender equality, if you look at the previous MDGs, there was a gender goal, but it was very focused on a few little targets like, can you get women in political office? This goal, SDG 5, has a much more complex and robust set of targets which link through the role of women and gender in terms of economic empowerment and legal empowerment. It has political empowerment. It has issues like violence against women. And more important, it recognizes a dependency across that unless you're focusing on gender, you simply cannot make productivity improvements in areas like the global health space, which is now goal 3, or indeed the hunger and poverty space, because if you don't recognize that there are massive reductions, or that women represent about half the labor in smallholder farms, and farms are how they feed themselves and come out of poverty, and you realize they have access to smaller plots of land, less access to financial resources, they're less likely to get extension services, they have less time to farm because they have more household duties. Unless you take a deliberate focus on gender, you simply cannot meet those goals. That's as much, if not more, true of all the health goals, again, when we come into them. So that's our shared framework, and that's become the dominant framework within which we're now trying to build the advocacy coalitions to drive the next set of goals, and they're all attached to a very specific set of targets. The problem, though, is when you're trying to get resources going into these areas, you need to tell people what was on that first graph that I showed you, that success is possible. We do a lot of focus groups, like to test. People are skeptical. In today's world, the same world that they believe that 50% of Americans believe that their families are worse off than they were 50 years ago. That's factually not true by the numbers, but it's a perception, and it's a perception that drives a lot of politics, and it drives a lot of the outcomes we're seeing in today's United States. There's a perception globally, and this graph is one of my most depressing graphs, but I find that it is this actually represents a survey of 20 countries. This is not the United States. And the countries that are being surveyed include China, India, Brazil, and big developing countries that have seen massive progress. And the question that is just asked is, do you believe in the last 25 years, global poverty has stayed the same, gone up slightly, doubled, halved, or decreased or decreased slightly? And as you can see, over half of people think it has actually increased by 25%. 20% think it's actually gone up by 50%. Only 18% think it stayed the same. Only 1% get the right number. We could go to, and have chimpanzees throw darts, and they would get a much more statistically accurate result of what has actually happened to global poverty, because that's what happened. But if you're dealing in an environment, interestingly, even in China did at least believe a majority of people, they thought poverty had decreased slightly, but no one thought it had halved. If you're in that environment, and this is true again in the health environment, if no one believes these health outcomes have happened, if you're not aware of it, the first thing you have to do is tell the story of how success is possible and can happen, and the direct interventions that we make in child mortality, maternal mortality, increases in access to family planning, so lead to demonstrable outcomes. So one core thing is the storytelling, because unfortunately facts on their own turn out not to be great changing minds. So what we've done at the Gates Foundation, and again, in the Q&A, we can maybe talk through some more specific examples of how that applies in key areas we work on. And we were pushed very hard because Bill and Melinda, as this evolved, realized, wow, the advocacy component of what we do is as if not more critical than just about anything else. The advocacy part of the world that, I've been part of the foundation, you heard a little bit of my bio that came through there. Even when I first joined, it was like, we think we need a little bit of advocacy. But we didn't really have any developing country presence in any meaningful way. We didn't really have any presence or engagement outside the United States in any meaningful way 12 years ago. We didn't think about advocacy as something that we still thought of it, we'll create some tools and then we'll go and tell some people that it's a good thing to do. And actually, as it's grown and changed, we've realized we need to be much more sophisticated and thoughtful, and that advocacy has to be an absolutely critical core component of what we do and how we do it from the very start. And often from before the start, before we even know a product's coming in place or a new intervention, can we start seeding the ground? What does that look like? There are interesting examples we're looking at, quite controversial areas like the potential of gene drive, for those who do it in mosquitoes, is could you use that to potentially eradicate malaria down the road? Well, that requires a massive amount of advocacy socialization in advance about what that is, because it sounds kind of frightening if you're using genetic engineering to help engineer the extinction of a potential species, and what does that look like? And so what are the components of that, and this is something that we might discuss over the next 10 years. So how do you link that in, and what are the tools, and how do you think about this? So I'm not going to make this your homework. This, I promise, is the most complex chart I'm going to give you, but this is something that we developed internally at the foundation, trying to say, well, we might not have the same degree of sort of input-output. Like if you're part of our colleagues in the vaccine development space, you have the luxury, you're developing a brand new vaccine that's going to deal with HPV or a smarter bit of rotavirus, you can then track the development. You have a product, you have the price per product, you're able to then think through a delivery mechanism, and you're able to track it all the way into the kid who needs it. And that's very concrete. In advocacy, you don't have that same ability to do that and drive that. And for those taking photos, we're very happy to distribute this afterwards. This is not proprietary information. We're all about trying to create public goods. But what it did do was a great way of forcing us to think and saying, well, what are our tools? And if you start on the left hand there, you actually go, it's not just dollars. Dollars are what we're kind of known for, but it's time, it's leadership time and voice, and including our convening power. It's very underestimated the degree to which you can convene players and actors together to help them drive towards common goals and conclusions. That's a great example, again, in the family planning space of what we in Oying was very involved in, and that they did with the London Family Planning Conference in 2012 to help reset a global agenda and a set of focuses around family planning outcomes and how you shift that discussion. And it's rested in reputation. The reason we have reputation there, you guys have an amazing reputation at the Johns Hopkins School because of your background in public health. That's a critical starting point. Because if you want to tell a story that gets believed on the previous chart, you need a development of trust. And one of the Gates Foundation brands that is so critical, I come back to, is we're perceived, for the most part, few people have a more critical perception of us, as, what I like to call is technically expert, meaning if we give advice, you should be able to trust that we've really kicked the tires and tested the analysis. We don't say things because we believe them. We have gone and rigorously tested, and we are agenda neutral, other than our agenda of wanting to help the poorest and neediest. That's our mission and mandate. There's no secret. We're not doing it on behalf of, you will occasionally get suspicion of, is a US government aid project secretly there to help bolster things? And I'm not saying anything negative about USAID here. It's just true. If you represent a government or intergovernment, there are perceptions about our only goal is to be able to have that be, and that actually helps our advocacy. It makes us a much more powerful set of partners to do that. And then you have to be thoughtful about your audiences, your tactics, those are each of the categories, how you measure intermediate outcomes, and then in the end, your success or failure is broadly our key tools of funding and policy, but it needs to be funding and policy that do this last thing as key, and we need to be able to track it. They either are products and services being delivered at scale. Can we measure them? Can we track them? Because if we don't have that outcome, which is actually affecting people's lives, then the rest of it doesn't matter. We don't care about great events for the sake of events or glossy publications or whatever, unless they are demonstrably means to an end. So let me make that concrete before we shift into it, using a live example, which I already mentioned, which is the Global Fund to Fight HIV, TB, and Malaria. And the reason that it's not just that it's been a great example and arguably, to some degree, the public-private partnership that has saved the most lives directly of any other in recent history. It started again in 2001. We're the largest non-governmental funder, but there's a wide range of governments that fund it. What that's helped do is not just drive attention and resources to those three deadly diseases, HIV, TB, and malaria, which have historically been the three biggest killers of preventable death in the developing world. In each of those interventions that the Global Fund resources in the HIV space was able to pool money and actually use that pooled money at scale, working with other programs like, in this case, the PEPFAR partnership in the United States that Washington drives, to massively drive down the cost and efficiency of antiretrovirals. The cost per person, and to then make that much more accessible for poor people. And so today we have, roughly 17 million people living on antiretrovirals, the vast majority of them in Africa, who would otherwise be dead. And they're living today because of the taxpayer generosity of the United States and others philanthropic, and they're living at a much more efficient rate, and that is a massive contribution to society. In the malaria space, the advent of bed nets and other things and so on have driven malaria down, and malaria deaths have basically halved of that same period. We have a little worrying. Last year was the first little slight uptick after 15 years of steady decline. So you can never be complacent, and there are reasons around that. Tuberculosis, often a little bit of an orphan discussion, but also has seen a massive drive and drop in overall mortality, although there are actually more TB deaths right now than there are HIV deaths annually. And so to some degree, maybe that's an underutilized thing. Right now, we have a global fund replenishment that President Macron is going to be, the global fund, President Macron is going to be hosting in Lyon in November. That's trying to bring together governments, partners, actors. We're trying to raise $14 billion for the following 3 years. $14 billion is a massive amount of money in today's. That's an increase over the last replenishment. We know, and we can demonstrate this is incredibly effective in terms of results and outcomes. The traditional critiques that does foreign aid, that lead to, does it actually save lives? Is it wasted? Is it all corrupt? We say no. When it comes to the case of the Global Fund, we can demonstrate not only is it not wasted, it's actually become more and more efficient year on year. We have better outcomes. We have strengthened local partnerships. We have sort of, on every measure in disease and that, we are able to point to a really great success story. But to get that happen, we have to pull together that evidence base, the data, the facts of what it's done, which we do. You need to appeal and use your access at the highest level. In this case, it was a direct appeal. We won't say it was the only appeal, but I like to think it was persuasive. Bill and Melinda were able to meet with President Macron directly last year and say, here's the reason why we think it would be so critical for France to be part of being able to host this and pull it together and get to the results and outcomes. You need to fund a coalition of advocacy actors. We support, not exclusively others, but groups like the One campaign, you may be familiar, that Bono helped found and that we fund, who I actually was meeting with this morning in Washington, D.C., are big components of Voice Out. The Friends of the Global Fight are a set of groups that work in, and they'll work in country. There's a Friends of the Global Fight group that works in Tokyo in Japan, because Japan is one of the biggest funders of it. There's a Friends of the Global Fight that works in France, because France is a very big funder. There are, within the other diseases, there is Malaria No More as a group that we help support, which does malaria, which helps drive that. There's the Stop TB Alliance, which comes in. What you need to do is look across all those entire coalitions of actors, have them be voices which activate local political leaders. And these are, and last but not least, and I'll close on this because this is something we may want to come back here on the Q&A, is, when we come back to sort of the UN, in the end, it's about these are just recipients in a developing country, because our focus is on a developing country. What you need is developing countries themselves, not just to be aid recipients, but to actually be driving and building sustainable structures and systems and programs to look after the health needs of their own people. And in all the areas we work, whether it's been in the vaccine area, whether it's been in the HIV, TB, malaria, whether it's in family planning, whether it's in neglected tropical diseases, whether it's in some of those areas I mentioned beyond that, like agriculture or financial inclusion, the long-term key is both you need co-funding and contribution from developing countries. And so we've been able to start building constituencies within the developing countries that help drive that. A lot of the work your team here do on family planning that we help fund through the Gates Institute actually helps look at that in the Advanced Family Planning Program, is about building those coalitions at country level in Kenya, in Indonesia, in whatever, to provide domestic resources and policies that are going to complement the global support that comes in. That is how you try and sort of pull together larger coalitions of developing country and developing country voices to do that. And one recent example we have is that Bill Gates was actually at the recent African Union, which is the collection of all African heads of state, which met in Addis Ababa in February, with President Kagame of Rwanda was the outgoing chair. And they held, for the first time ever, a African conference about healthcare co-financing for global health issues like this. So President Kagame convened heads of state, finance ministers, and health ministers. We were a partner with them, and it talked about the real nature of, in the end, the drive needs to be about developing countries putting in their own resources. And again, the advocacy about why those investments are not just about saving lives, which is a metric we care, but they're building the long-term, sustained, healthy citizenry that are going to underpin economic growth, political stability, the long-term future for each of those countries. And that's why advocacy is such a critical component for all of those execution results. And that's why we're both so pleased that you are, as far as I'm aware, still the only health institute that really has advocacy as such a central track of what you do and how you think about public health, but also why I believe it's going to be so important in the future. So thank you very much.
So thank you, Mark. The last time Mark was here was about perhaps more than 3 years ago. We convened a high-level consultation of thought leaders in advocacy, and Mark and Senator Ben Cardin, who was, I think, chair of the Foreign Relations Committee at the time, with the two keynote speakers, if you remember that. So more than 3.5 years later, you're back here. There is now a Center for Public Health Advocacy. And with the support of the dean, we will move it into higher priority within the school. So Mark, you joined the Gates Foundation sometime in 2007. I joined sometimes in 2008. And Bill, I think, got more active from Microsoft to the Gates Foundation maybe in 2009 or 2010.
Yeah.
I'm not exactly sure.
Yeah, end of 2008, I think. Yeah.
End of 2008. And what I heard, and you can confirm this or deny it, was that Bill, when he came in, he said, what is this policy and advocacy stuff that you guys are doing? Why are we even investing in this? And then somehow, in a very short period of time, his mind was turned around and identified policy and advocacy as one of his top priority. Since you were at the higher level at the time, what happened? What was the turning point in that short period of time? Why he immediately changed his mind?
Yeah, well, so a couple of reasons. And yes, you're right. So there was a... Oh, okay. Hopefully everyone heard Oying's question. For those who didn't, because it turns out his mic was not on, is what happened and how did Bill and Melinda, Bill in particular, suddenly discover that advocacy was so important when he didn't really think very much about it for the first 8 years of the foundation and while he was busy at Microsoft, which is a slight overcharacterization, but not that much of one, which even he would give up. And there are two aspects to it. One is just the easy answer I always give is I am incredibly persuasive personal advocate. So, when Bill and Melinda came on board, it's just I was able to talk to them. But no, it's not just advocacy as itself. It's also how we engage, and particularly a lot of the areas which we didn't talk about at all then was how and what we do in developing countries. What I was talking about, the notion that I ended there, that Bill Gates would go and keynote a speech at the African Union in consultation with the chair of the African Union to talk about the importance of domestic financing by African countries. He himself would admit that was so far off the radar screen of what he might be doing 10 years ago, it just wouldn't even have occurred to him. And I think one element of it was just learning and seeing, particularly starting in the United States, where it is about how you build constituencies, like the constituencies that end up voting for the US contributions for Global Fund and PEPFAR and Gavi and the Global Polio Eradication Initiative, which I haven't talked about. He started having discussions himself on Capitol Hill and realized that he and we become an important validator. If you start from that skepticism that results are happening, someone like Bill Gates and something like the Gates Institution, we're a pretty hard-edged numbers kind of person, and no one's really going to look at Bill and say, no, you're too touchy-feely about this. You should look at some data. And so it realized that there's a value add that he could provide, that it was still seeing it in a limited time frame. Then I think what really fundamentally happened, they'd already done some travel, but both he and Melinda started doing much more travel themselves. There is no substitute for direct experience and exposure. Love PowerPoint though we do, as a Microsoft invention, of course we do. There's a limit to what PowerPoint slides can actually tell you. Persuasive, and that being able to be out in the field and discussing with people and seeing how complicated it is to build the kind of coalitions and champions around, particularly in an area like health, which I suspect this room is a slightly self-selected biased room and all believe it's important. But when you go and do polling, that's not what's top of mind for most people when it comes to voting in elections, whether you're talking in Kenya or in the United States. Generally, that unless you are yourself facing particular healthcare or healthcare cost challenge, because we know that the impact of not having health financing can be absolutely destructive for a household if you suddenly have a massive out-of-pocket expenditure for a hospital payment or something like that. And so how you start making that case, I think it was a combination of Bill and Melinda just spending more time talking about it because they really do, and I'm going to talk about it. You have Melinda's new book sitting on the table, which comes out today. One of the, please all, I highly recommend it, genuinely, not just as a plug. But one of the things that comes through incredibly strongly in that book is how influenced she has been by the stories of the women and that she has met on her travels over 20 years, and how that's fundamentally reshaped her own perspective and how she operates and engages, and the prioritization she puts around how and where she uses her voice. So I think it's that combination. It's us getting slightly smarter and more sophisticated, the tools, that theory of influence I showed you out there, saying, we can tell you how and where we can deploy resources more effectively in advocacy, and even if your outcomes are intermediate, we can show you a connection and get to those results. And themselves learning by doing and seeing that the access and influence they have and can get and use their voice actually in many ways is as, if not more transformative than, the intervention our funding might be buying.
Thank you, Mark. So there's observation, I think, probably is coming from within, but also from without, that Bill starts with the science, the evidence, the numbers, and somehow he ends up on the human condition. Whereas Melinda starts with the human condition and gets on the science, of it. Is there truth to that, or are they on the same page right now?
Yeah, so it's interesting, and I know that perception holds, and actually it's a sort of nice, powerful framing, and there's some truth to it, although again, when you read the book, you'll realize that Melinda herself started life as a sort of super data geek back at her school in Dallas, and she was then, at Duke, she was a computer science major. She did her MBA. She ended up being an early pioneer. So they actually bonded first over being, doing like math puzzles with each other, which is not how I did my first dates with my wife, I should acknowledge. And they're both very empathetic, and so that bit that I talked about being carved on our wall, that every person deserves a chance to a healthy, productive life, and every life has equal value. It's fascinating and actually to some degree really inspiring. That animates both of them deeply. And a big chunk of it comes from, Bill Gates Sr., who played a very instrumental part in helping, build the Institute here. For those of you who had the opportunity to meet or see him, he kind of embodies that. And I think, by all accounts, Bill's mother, who died many years ago, was very much like that. So I think a lot of it is, but they both believe that passionately. So there is a human connection that starts even with Bill. Melinda is definitely you can drop Melinda and other stories in just sort of almost any group of men, women, or children in any part of the world, and she will create a connection with them within 5 to 10 minutes, which is pretty impressive for a sort of super billionaire who doesn't, that, and she's able to do it. Bill maybe finds it a little bit more challenging to do that breakthrough, but they are both just as passionate about the people. And, I've seen Bill move to tears in sort of areas where you see these powerful stories. So I think they actually bond on both. What they do, because that's, the explained, I actually have 2 hats at the foundation, both the head of policy and advocacy, but also more recently as chief strategy officer. And what that tries to do is, we get to allocate a huge amount of resources. We're the largest philanthropic foundation in the world. And if we're going to be allocating those resources, we need to be thoughtful about how we're allocating them against the highest impact. I talk about how do we make sure they're not actually doing something duplicative that others might be able to do? What makes it distinctive? Are we investing it in interventions that really are going to maximize the output? That's where the data side, which Bill certainly pushes us, but Melinda does. We need to be absolutely rigorous on the data side, sometimes to the deep frustration for some of our partners and grantees. I'm sure, again, that's never happened with this relationship because we're so hands-off. No, we're not. We are, for better or worse, an unusually hands-on donor. Some people don't like that. Some people are more comfortable with it. But a lot of it is just that we want to exchange in real time, as we do with you guys now. And we want numbers and data and stuff to drive. So it is both of them. You said a couple, but when we do strategy reviews, so we have a very long table for whatever the team is, and Bill and Melinda sit together at the front of them, and they will both do it. And yes, actually that, Melinda will more visibly do some of that, but it's actually a connection that cuts across both of them very deeply.
So there was one town hall meeting at the Gates Foundation that stuck in my mind. And Bono was there, Bill was there, and Melinda was there. And somebody in the audience asked, Melinda, you can have everything in the world that you want. What is the most important skill that you think you need to learn? And she said, I need to learn more from Bono, the art of storytelling. Mm-hmm. So now that she has this book, I presume you have probably read portions of the book. Where is she now on the art of storytelling?
Yeah, so I've read more than portions because I actually had to do the sneak preview Q&A for the Gates Foundation, which we did 10 days ago. I was the moderator for Melinda, which is a tough job. I'm much easier to moderate than Melinda. And so I was looking at stories, and that really is, that art of storytelling, which I come back to, it's the way you connect. I say that Bill and Melinda are unusual people, and this Bill will agree, he's the extreme version of, why is the world not just convinced by data? Data, his first question is to ask for more data, his second question is to ask for even more data, and his third question is say, you obviously don't understand the data, give me the underlying papers and I'll read them myself. And that is not an exaggeration, that is how he operates. Yeah. And then he will actually change. One of the other great distinct things about working for them is we change our minds all the time. The Gates Foundation fundamentally changes strategies, which many institutions don't do, because the facts change, the evidence changes, the learning changes. That is one of the bits of flexibility. But that really only works for a very small proportion of people that you're talking to. You need to humanize it. In the end, we're all human beings. This is about, those might be numbers, but when you talk 17 million lives saved is a very abstract number. But if you meet a young woman who is on antiretrovirals and was able to give birth to an HIV-free child because she was on antiretrovirals and able to hold down, that's a much more powerful and moving set of stories that help persuade you. Said, oh, it's great for my taxpayer dollars to be re-upping the global fund. And it also helps change the way you operate. There's a whole section in the book there about the early Avahan program, which was our work on AIDS prevention in India, where they talk about, the idea was in the early days that the big new wave of the AIDS epidemics, this is in the early 2000s, was going to go to that could China and India go the way that Africa has been going in terms of just the scale, because Africa, the epidemic had already hit. And so we started working in India, and the idea was to work on sort of prevention schemes, just more broadly in education schemes. And what we never thought about at all, but you found about by listening and then have a program is, we were thinking about it turned out the constituency to work with was sex workers, and to work with sex workers directly and helping. But then you had to meet them where they were in terms of what their clients were willing to do or not do and how to do. And so then again, there's a great section in the book about, Melinda talked about how both for her and Bill, they would never, had they been asked at the beginning to approve a program that was doing what we ended up doing, they probably would have said no. But when you hit the connection of reality and what actually was making traction, and there's a great now quite rigorous study which shows just the impact of lives saved that program ended up having. And so that's the kind of case study again and again. The stories, and they're in there on sort of family planning, but Melinda has a very moving story in there about, meeting a woman, I think it was in West Africa, I think it may be Niger, who had, multiple kids, and who actually at the end of the meeting very powerfully just asked Melinda if she could take her youngest child home with her. Not because she didn't love her, but she just didn't know how to look after the needs because she had too many children. And that had as much, if not more impact, that story. As Melinda has all the data she'd been reading herself about these issues. And so that is one of her motivations for writing the book. It's one of the things we're constantly thinking about campaign. Data on its own is useful, storytelling on its own is useful, but if you can link data and storytelling and then connect the data and storytelling to a set of interventions and say, on the basis of this, here's what you can do. Some of it may be an investment, some of it may be an action you can take. That's the most powerful advocacy of all.
I just got this book this morning. It was launched this morning. So I'm a very fair guy. So let me just read to you one sentence here. and pardon the nutrition, the vaccine, and polio people here. It says, it took us years to learn that contraception are the greatest life-saving, poverty-ending, women-empowering innovation ever created. Even a much stronger phrase than what the former head of UNICEF, Jim
Grant.
Grant said. So I'll give more time for the Q&A, so I'll ask you my last question. So why the need for a chief strategy officer at the Gates Foundation? And why you?
Yeah, well, it's a good question because there wasn't one before. So, two reasons. So, one, which I was alluding to there, is because we do give away, so we had ended up creating a lot of very different vertical programs where we hire many of the best people in the world, but we have an agriculture team that's filled with agriculture specialists, a tuberculosis team filled with tuberculosis specialists, a family health team, a family planning team filled with family planning, a domestic K-12 education team, and each of them were building things that were quite idiosyncratic that worked for them, but as if they were some. Then we had slowly been realizing, and this was part of the work that was underway when you were doing, we expanded up and I helped develop in around 2011, 2012, when we're all operating in the same country. So let's go in India, we have each of these programs. It's actually highly confusing if you turn up at the health ministry and we say, well, I'm coming in to talk to you about tuberculosis. My colleague from the HIV team will be along in a week. My colleague from the family planning team will be here next week. And if you could find, my neglected tropical disease colleague will be there, and they're all going to ask you the same thing. Because I'm the health ministry official. I deal with all these issues. Could you please at least have a collective set of conversations with me too? And so part of it was we then were building regional functions to pull those together. And then as you think about them, you need to think market by market. What and where do you strategically lean into one or the other? What are the criteria you use if we're going to put money and resources into it? So one of it was just a nuts and bolts thing of, could we create something that's just a bit more comparable? And we now have 2 weeks a year, we've just come out of strategy reviews with Bill Melinda, where we sit down and literally for 2 weeks, we go back to back to back to back every day, and we cover every strategy in the foundation. And we go with, and that's partly to allow us as a team. I sit in every single one of those as chief strategy officer too, but it's a lot to take in. But in the end, you've got then major resource or strategic direction questions at the end. It allows you to look at it collectively and say, well, do we need to lean in or do a course correction here on the family planning or other areas? Can we use common metrics or measurements? Can we do a version of what I had there in the theory of influence, which is how we think of trade-offs in our advocacy space, in our product development space, in our delivery workspace. And so part of what we've done in the last couple of years to do that is just create a much more common infrastructure and template. So each teams now have to use a broadly similar way of presenting. That's not. The second bit as to why me was a question I actually asked them at the time they were. Anyway, I said, well, unlike many people who do come to foundation, I have no consulting background. I do not come from McKinsey or, I'm not that actually numerical, unfortunately, which makes it challenging sometimes. I'm an ex-journalist, as you heard from my bio. I'm good with words.
The Financial Times.
The Financial Times. Yeah, true. I had to learn some numbers for the Financial Times. That is true. But that one of the things that I'd already been seeing from the advocacy perspective, and that I thought was one of our biggest strategic gaps, and I said, if this is what you want out of a chief strategy officer, then I'm happy to do, is the missing connective tissue across all of them. How these things all link up together. I'll use an example that again is live with Nigeria, and just particularly because Bill was having a conversation last week with President Buhari, the recently re-elected president of Nigeria, and where they were discussing human capital. When Bill was in Nigeria last year in person, he gave a speech, a pretty tough speech, directly to the president and the Senate there and many of the chief governors, about how on many indicators Nigeria is, for a comparatively wealthy country, it's a middle income country by per capita GDP, it has some of the worst outcomes in terms of health, education, and other reasons in terms of poverty burden. And that's because they are massively underinvested in particularly health and education as the two key areas of human capital, unless they did something dramatically different, which is a tough message for a foreigner to come in to do. We weren't quite sure how it would land. It did have the support of Aliko Dangote, who's the wealthiest man in Africa and Nigeria, who's a strong partner for us working on polio, nutrition, and other areas. And that helped trigger a really good set of discussions about, well, how can we ladder up all of our, health investments, including in the nutrition space or others. In Nigeria, we work across pretty well all these areas: polio, nutrition, maternal child health, family planning, and they were all pieces. But by doing that, we've helped the Nigerian government come up with a much more joined up discussion. They've launched a Human Capital Commission themselves. The president last week committed this is going to be a priority for his new term. That also gives you a framework that allows other big funders. I also just came from a meeting with the World Bank this morning. The World Bank will align a chunk of its funding now collectively in a cross-cutting health way against some of the interventions that we're helping the government of Nigeria develop for itself. So the strategy officer component and the value add that I hope I bring in the role is about how do we make sure we're more than the sum of our parts when we do and we have similar sets of questions in our domestic work, say in education, but that's the role. So it's a distinctive kind of, in strategy office, it's about resource allocation, making sure we're more than the sum of our parts and making sure we're being thoughtful about our allocation trade-offs. It's not about going deep, narrowly, strategy by strategy in what we do. We trust our teams to do that.
So I think we're good for 3 to 4 more questions, Q&A, Diane. So we'll take 3 to 4 questions from the audience. Just raise your hands, and Professor Lu.
Hi, my name is Lilio, and I'm a researcher who works on child mortality and also a lucky Gates grantee as well. So I guess, with the school's new strategy, with advocacy being one of the 5 pillars, we all have increased appreciation of advocacy. But I think, to have sustained engagement in that particular area, applying your theory of change framework, we also need investment in that as well. So I don't know, with your chief, strategy officer hat, would you be able to also, maybe you've done this already, but maybe continue to advocate for, funding sets aside that could be included in the Gates grants that would actually be allocated or earmarked for advocacy purposes specifically?
Yeah, and that is actively part of what we do now, program team by program team, and it helps enormously that we are now a separate division. So we actually have a structure where we're embedded, because last thing you want to do is create inadvertent competition even within I don't want advocacy to become the stick you come and beat the programmatic team, someone say you're not doing enough, saying as they themselves can see more of the value add team by team, because it's still the bulk of our funding. I mean, we have significant advocacy funding by any global standard. Within the Gates Foundation, we're the sort of, I wouldn't go so far as to call us an orphan, because that sounds sort of awfully, and we're not. We've got a lot of resources, but we spend far less. But what we do is we create a kind of rough benchmark norm. And what we've done is, just for the sake of discussion, we go with each team and say, historically, we think a rough benchmark is each team should be thinking on the order of putting 3 to 4% of your overall resources in advocacy. And we just do that as a starting discussion and say, but then let's discuss with your team and see whether that makes sense or not. Use that as a benchmark. So as a team, you kind of have to justify why you're doing less. And there might be more, we have asked the great partners or others do it, or why you're doing more. So, and you'll have extremes. So one extreme, our tobacco budget is 100% advocacy. We don't feel we need to do more investments on, is tobacco a bad thing? But what we do need to do, particularly in Africa and Southeast Asia, where we do the bulk of our work, is try and apply all the lessons we've had here about, restrictions on advertising, hypothecated taxation, other things like that. At another extreme, polio, we care a lot about this, a lot of advocacy. We spend an enormous amount of money on polio, so we don't want to actually divert more. There, it's about 1% of their budget goes on advocacy, but it's partly because it's a very large budget and partly because we're able to use other tools. Family planning is an interesting one, where it's one of our largest components. I think it's 12% currently. We're looking at it close enough, 12 to 14%, give or take. which I think puts it at the very high end, but that's because in the family planning space, when we sit down with our program team, we say, this is an area which fundamentally needs a reset. It had got sort of, it never got really neglected in the space, meaning it was always part of the discussion. It did get neglected in terms of funding allocation and resources and actual application for many years.
Yeah.
And so therefore we really wanted to lean in heavily. What does that look like? And so yes, we do that. And then a second component of that is then within that, okay, we've agreed to spend a certain amount on advocacy, but which of those component parts, back in my days, so sometimes you need some better sort of policy framing reports to help drive a discussion in a different kind of way. Sometimes you might need something that is a little bit more, mass mobilization and public awareness. So you're trying to go to the public. So you have a different, another might be about messaging. So we try to do both components. But yes, that's absolutely now a hardwired bit of how we do business, both internally and then externally. And I don't think we have a single advocacy strategy, not even our discovery and translational sciences, because there we now advocate for R&D money to be allocated into these spaces in it's sometimes a different audience, but it cuts across everything we do.
So, Al, you have hardball questions, you said.
So if I've heard what you said, Mark, when I think of advocacy, very superficially, I think of who the audience is. It sounds like you have two audiences. Bill and Melinda is one audience, and governments are another audience. What about all the rest of the world?
Yeah.
Is that really where the money is to go after government? I mean, we always think that you can change government policy. You still got to get people to do things. Look at the measles outbreaks. I mean, do you ever think in the level of advocacy in terms of marketing to populations as opposed to the decision makers?
Yeah, oh, absolutely. And so I'm sorry, I won't bother putting that chart back up, but one of the middle columns in that chart is actually a segmentation of audiences. And we have about 6, and we don't count Bill and Melinda. I think we count Bill and Melinda as a one-over audience. They're just now want to be deployed. Yeah. But we actually categorize, and we also try and look at when are we, meaning ourselves, like as the Gates Foundations, and we tend to be most influential with what we call influencers and policymakers. We've tested that. Our credibility is so when we're coming in ourselves, it needs to be people who are already partly energized or who are making policy for whom we're seen as great, and often we're able to have access. So we would target a certain kind of our messaging and structure around that. Then often, if you take again that global fund replenishment I was talking about, and the previous global fund replenishment was actually hosted by Canada, if we use Prime Minister Trudeau did it. There, he needed to be able to show that there was domestic support in Canada, and he wanted to engage in youth. So one of the areas we ended up supporting there, along with some other partners, in this case, we didn't actually have Bono part of that concert, but we helped create a concert with this group, Global Citizen, which took place in Toronto around the time of the replenishment conference, which happened to try and drive and show, and can you get energy there? And there you're going for more of a mass campaigning. Can you actually get younger people engaged? Because there's a big constituency out there, especially in universities and others, of people increasingly interested in these issues, looking for ways to engage. And then you have sort of intermediating categories that come up there. You might have a specific thing around media, because obviously media is an amplifier. And these days you have customized strategies around traditional media, which again, as an old fuddy-duddy print journalist, I have a slight bias too, but I've been, social media, unfortunately, these days is a little bit more influential and viral, or fortunately, whatever, I just happen to be less good at it. And so how you categorize those and the audiences. So yes, absolutely, for each of the things we do, and we're trying to think of many of the areas that we ourselves will be less good at. So you're trying to look for amplifiers that have access to particular audiences or areas. So again, just sticking in an African context, for example, we found that the last time we did an agriculture campaign a couple of years ago linked to the African Union called Do Agric, our most successful influencer was this Nigerian rap artist called D'banj Coco Master, who, those of you who haven't looked him up, there's some great videos, it's good music. But it turned out having him do that helped change the sense of an agriculture discussion, in this case in Nigeria, to something that felt more relevant and dynamic, and how you do it. So you're constantly trying to look in each case, do you have a different kind of audience? Can you get a different kind of voices who would just reach people we wouldn't reach? And then being selective about what are the direct things we could be doing directly, or the same as all of you. In the end, you will tilt in the public health advocacy component of people in the Johns Hopkins will tilt a little bit more to those who are respectful of technical credentials and a perceived set of expertise, because that's what you're going to be bringing to and drive. When you're saying why is vitamin A so important, you have to start with a fact-based about what's going to be, and then try and build the movements attached to that.
So our manager here says one more question.
Or we could take two together, and I'm happy to answer them as
last two questions then. And no, you raised your hand. Oh, so you first, and then Santos.
Okay. My name is Genevieve. I'm an MPH MBA student. I was actually an intern at the foundation last summer. And right now I'm in the throes of job interviews, hence the context for this question. I was wondering if you could reflect on your time at the foundation and share what is, for you personally, your proudest professional achievement.
Interesting. Before you answer that, Mark, maybe we can have last question from Santos.
Sure. Mark, thank you so much for what you all do for advocacy. I think it's admirable. You talked about having a series of vertical programs. It's not a good thing, but we should integrate. I think you're well aware there have been many successful vaccine advocacy programs. Sorry, Owen, I think vaccine is more important. But what happens with these programs, we've been very fortunate in having several of these advocacy programs. Pat has done a great job. Suzman has done a great job. You have these programs, they're very successful, and they're completely dismantled. So we've spent a tremendous amount of time developing the infrastructure, developing the context. It'd be very easy to introduce another intervention or another antigen, but that's not the way it's done. It's completely dismantled, and then another big project is funded, and that goes on for some time. I don't know if you have any comments about why that is, if it can be changed, or it's not possible to change it.
Yeah, so I won't tackle the specifics of the Suzman question per se, but if you do a sort of pullback on just vaccine discussions broadly, and it depends where you're having this, because obviously this is a live set of discussions here in the United States as well, given the measles issues and others that are related. And paradoxically, Washington State, where we're based, has many of the worst outcomes and the lowest vaccination rates in some pockets of it here. So we know that there are wider issues just about vaccine hesitancy writ large and how you think about that. But when you're talking about new vaccine introduction as a type of that, we have been trying to do that in sort of two ways. One is Gavi is our biggest single bet and player there, because we put enormous amount of resources into it, and its mission is by definition not vaccine specific. It's about when there are vaccines available that have proven safety and efficacy, we believe that children in poor countries should be able to get access to those vaccines as quickly and effectively as children in rich countries without what used to be a sort of 20-year time lag in happening that. And so that's neutral across the program. You then get into challenging issues, which you know well, about the different cost per vaccines, because some are much more expensive than others, or what the right kind of way to introduce a vaccine, like HPV, because it goes into younger women, does not naturally fit into a vaccine schedule that you might be having in the regular EPI for children. But we absolutely are trying to have that more about how you think about the platform writ large and how you then add on the next marginal vaccine, because I think that's you will still have some areas, and a good live example where we're kind of testing something, in this case with a prominent partner, Save the Children, is can a vertical set of advocacy actually drive you a better set of horizontal results as well as vertical outcomes? So in their case, experiment Save the Children UK, in part with our funding, currently underway have a major pneumonia advocacy campaign, because pneumonia is still, again, causes of death, as you well know, there, but one of, if not the largest, still killer. The pneumonia vaccine is actually large and effective, but many large countries still don't introduce it for cost. Indonesia doesn't have it. China still doesn't have it in its API schedule. So can you drive something like that and say use that thing, because that's a powerful bit which individuals can get, but help that drive both pneumonia-specific interventions and that they're strengthening the vaccine platform, because we would hate to be one or the other. But there's no neat answer to it, but we're trying constantly to manage that tension between the horizontal and vertical, which to some degree is healthy. We will always tilt a little bit more to the vertical than many others, because that's just how we're structured. But it's not to the exclusion of the horizontal. And it's one of the reasons why, even since Oying left, we now have a division of our foundation called the Integrated Health Delivery Division, which didn't exist, which actually just got combined with our vaccine delivery team under single leadership just 3 weeks ago or a month ago, exactly because we feel you need to link those common platforms with the specific interventions. Then back to the question about what I'm proudest of during my time. There are lots of specific moments and interventions which I can point to that I've been proud of being at. Like, we had a big Abu Dhabi vaccine summit about 4 years ago, which really was trying to combine exactly some of those vaccine messages also with the last phase of polio financing, which many others helped contribute to. There are other bits like elements of work we've just launched 2 years ago around gender data as a single part to help drive the SDG 5 goals. And that I think each of those, but success has 1,000 mothers and fathers, and I'm only one component of it. If there's one broad trend, maybe bringing it back to where Oying started as a closing thing, that again, I'm certainly not the only person who has driven this within the foundation, but for the foundation and how we operate. I like to think that during my time there, the degree to which the foundation thinks about, incorporates, acts, and works with, draws on the voices of the people on the ground in developing countries who actually have to do the work, who are going to be responsible for the outcomes, are going to be key to the sustainability. We are in a fundamentally different place and set of discussions about how we do that and how we drive that, because in the end, long-term sustainable success is about empowering those in the field to help do and drive it, not what we sitting in Seattle or Baltimore or whatever can do. And again, it's a contributing part, but that's probably the shift during the foundation timeline that I've been part of that I'm proudest of us doing. It's a shift that is still very much underway rather than complete. But I think it's critical to our long-term success.
Is that what you call downstream in the internal language?
Well, downstream means it's more in the sort of delivery and implementation, as opposed to upstream as just a pure product. You're developing a brand new product. So this is an element of that. Downstream could be we just fund the global fund and we let them figure that out. But in this case, it's both and. We will work with the global fund, but we will also have a Nigerian office that is able to develop that set of ongoing discussions I talked about with our Nigerian partners about what it means to invest in Nigerian kids at local level. And I hope that's going to be part of our core operating model and DNA till the foundation ends. And as many of you may know, we are a foundation who will end. We are a lifetime. We're not endowed. We will shut our doors within 40 years of the death of Bill or Melinda, whoever the last of them to die is, because they want us to focus all our resources on today's problems and today's challenges against these issues.
So thank you, Mark. You would like to thank Mark for taking the time to join us here.